Welcome everyone to the Utah League of Cities and Towns COVID-19 Economic Impact Town Hall. It is election eve, and when we started the conversation around COVID, what seems like 10 years ago, but was actually, if my math is right, about 8 months ago, little did we know that it would consume all of the attention and all of the political oxygen throughout the election cycle. I'm Cameron Dale, the director of the League of Cities and Towns, and we are grateful today to be joined by a couple of the key experts around the state's COVID-19 response efforts on the economic side as well as on the public health side. Juliette Tennert of the Kem C Gardner Policy Institute, the chief economist there, as well as the president and CEO of the Hospital Association, former Lieutenant Governor Greg Bell. We also will hear from ULCT Policy Director Wayne Bradshaw, because this is the final week for cities and towns outside of Salt Lake and Utah counties to apply for the third tranche of the CARES Act from the state portion of the Coronavirus Relief Fund. You have until close of business on Friday to apply for those dollars. And so Wayne will go through the most recent federal guidance about those dollars and make sure you understand what's expected of you. So with that, let's start, Juliette, with the economic outlook, where things are and where things are going. I feel like, for the most part, every time we've had you on, you've been able to make lemonade out of lemons. So here's hoping you can do that again, despite everything that's happening out in the world right now.
Yeah. Well, thank you so much, Cameron. I will definitely give that a try. And as I'm pulling up my screen here, I will just mention once again that I truly appreciate the opportunity to present to you in these town halls. It's really helpful for me to share with you some of the things that I'm looking at, the data points that I'm tracking to help me interpret what is going on with the Utah economy and form my kind of predictions for what's to come. But it's so helpful to hear your feedback on what I'm looking at. So whether through the questions in this town hall or follow up after, please always feel free to shoot me an email. I just learned so much through my interactions with you because you are on the ground working through this day to day with your constituents. And it's such a nice complementary piece of data to some of my administrative type data that I'm always looking at my rearview mirror. So thank you so much for continuing to give me the opportunity to present to you. So November 2nd, we're at November 2nd, as Cameron mentioned, we've been about 8 months into this. I've been doing these presentations to you for about that time. Some things have changed, some things have not changed. I feel like I maybe have gotten a little bit grayer. I'm a remote kindergarten teacher right now in the Salt Lake City School District, in addition to an economist. So if tracking an economic contraction and teaching kindergarten at the same time are not going to give you gray hair, I'm not sure what's going to. So let's take a look at the data. That actually is really fun for me. So again, thanks for giving me a little bit of an outlet to do this. We'll keep things relatively brief today. And hopefully everyone, Cameron, thumbs up, the slides look okay. I know they're not as big as they could be, but excellent. And we'll, as normal, we'll make sure that we distribute these slides after the presentation so you can look at the little nitty gritty numbers, because I know it's hard sometimes on the screen. But we'll keep things relatively brief today to make sure that we have some time for Q&A. I'm just going to show you the data points that I've been looking at the national level, at the state level, and then at the local level. We could do a whole week-long dissertation on this stuff. And so I'm not going to get into all of the details with you, but I'm going to give you kind of the high-level overview of what I'm looking at and what I'm seeing. My colleagues with the Utah Economic Council and my colleagues at the Gardner Institute, these are the types of things that we're looking at as we're advising policymakers. So as the nation goes, Utah will go to an extent. We'll talk about why Utah's a little bit different. But I think it's really important in any of these presentations to understand what's going on at the national level. So let's take a look at a couple of national data points. And again, this is where there's a lot of detail on the screen. Don't worry, you'll see this and you can study this at a later time. But the U.S. economic contraction was swift and it was severe. There's all different data points that we can track, but if we look at sales data is a really good indicator of what's going on with the consumer. It helps us to understand consumer confidence So for those people who are actually still employed, what does their confidence in interacting with the economy look like? And then also, obviously, it helps us to understand what's happened to people just in terms of jobs and incomes and such, right? So on one side, folks still have jobs, still have incomes, pull back on their spending. And then on the other, actually more tragic side, many people found themselves in a place where they did not have jobs, did not have incomes, and of course, what they did with that spending followed. But between the first quarter and the second quarter of 2020, all retail sales in the United States contracted by 7%. This is a very, very large contraction. It's on the left-hand side of your screen there. You can see I've broken it out into the various sectors of retail sales. And we know this. I mean, it doesn't take an economist to tell you that restaurants and bars were just crunched, severely hit. Gasoline stations, as people pulled back on their traveling during that time, severely hit. Everything else you can see general retail sales. That's like, every clothing, all these kind of random miscellaneous things. 16% reduction in sales. On the flip side, a couple of bright spots. We saw our non-store retailers, Amazon.com, et cetera, et cetera. We saw actually quite a bit of increase there in purchases online. And then we also saw a little bit of increase in, of course, grocery stores as people were stocking up. But again, those little bright spots. So, and of course, the home goods stores. So as people were spending some time at home, had time to work on their homes and gardens, we did see a little bit of increase there. But again, those kind of bright spots were not enough to offset the declines in the other areas. We'll talk a little bit. We can talk a little bit about how we are seeing improvement. So this is like that swift, severe crunch as things kind of settled and people kind of got a hold of their expectations. They did start interacting in the economy again, and we've seen these numbers settling a bit, but it's a lot to make up. On the income side, personal income, if we take out what we call transfer payments, so there were huge dollars that went into American pockets via through the stimulus and also through unemployment insurance. If we pulled those numbers out of total personal income, because they kind of inflate the picture, incomes in the United States contracted by over 6%. And I just want you to take a look at what happened to non-farm proprietors. So these are all over kind of sole proprietors, or Uber drivers, sharing economy, real estate agents. Their personal income in total contracted by 10%. Farm proprietors, over a third. They lost over a third of personal income between the first 2 quarters of the year. So these data points speak to just how large the impact's been. And so now that we're kind of in this maybe recovery mode, or settling, recovery then settling, I don't want you to forget what an impact there was and how much we need to make up. Taking a look at the unemployment rate, just because that's kind of an indicator that most everyone is able to understand and is hearing this indicator through the news. I go all the way back through 2007 in this graph. The headline unemployment rate, the unemployment rate that we're used to hearing, is in black, and then what's called the U6 unemployment rate is in red. The U6 unemployment rate includes people that aren't normally counted in the regular unemployment rate. What we call it, like the underemployed, essentially. So a lot of folks in this rate might be working part-time and want to work full-time for economic reasons. They're working part-time, and you can just see, again, over time, you don't have to look at those tiny dates on the bottom. You can tell that when that U6 rate goes up above 20%, at least a fifth of all Americans were unemployed or underemployed in some way at least counted through the survey. And I would say this is probably a somewhat conservative estimate. You can just see just how large the impact was. So U6 unemployment rate hits 22.8% in April. It's now down to about 13%, 12.8%. Kind of headline unemployment is now down at 8%. So, I mean, Yeah, we're definitely in a much better position than we were when this stuff was all taking hold. But relative to our history, you can see that the effects of COVID-19, the initial kind of impact, are still at play. And then obviously, there's still a lot of uncertainty about the future. There are some bright spots when we look towards the development and the distribution of the vaccine. But then we counter that with kind of uncertainty about what happens as we're going into this winter season. And while we're definitely, talking about maybe a little bit of lemonade out of the lemons, and we're definitely in a much better place than we were. And I would argue we are in a much better place than we could have been. I do believe that fiscal policy and monetary policy were appropriately swift and appropriately large. I think that if not for those things, we would see ourselves in a worse, my opinion is that we would see ourselves in a worse situation now, but still, we are still in a challenging time.
Juliette, can I ask you a follow-up question there?
The economy is improving. We saw that in those data. There's still, unemployment rate is still at elevated levels, but definitely improving.
Juliette, can I ask you just a quick follow-up question?
Yeah, go for it.
So on 2 slides ago, go back one more slide, you had that 6.4% reduction in the personal income. That includes the CARES Act and the Payment Protection Program?
No, so thank you for that clarification. It does not. I pulled the CARES Act. I pulled those dollars out of that number so we could really understand what happened. I can't, off the top of my head, I don't have the number, but I think it's something like 9% increase. Actually, it's actually an increase because of that CARES Act funding, because of that fiscal stimulus funding. So when I talk about where we are in terms of the unemployment rate, what's happening in the economy now, if not for that massive amount of cash coming into the economy, I do think that we'd be worse off. But that's a good question, Cameron. So these numbers, I pulled the CARES Act out of those, the unemployment insurance, the money's going to small business, the money's going to individual family households. I pulled those numbers out just so we can kind of get the actual economic impact there.
Perfect. And there was also a question in the chat room about how this change between Q1 and Q2 compares to historical data. And
yes,
obviously,
so I wish I had that here
drastic,
for you.
But what do you normally see?
Yeah, so the normal, so let's just say for in 2019, retail sales in the US, I'm not going to make a number up, I'm actually going to read it to you so I don't leave you completely off, but where am I? Sorry about that. So, usually retail sales are, in 2019, 5% growth. In 2018, 6.5% growth. So that's kind of like a normal, and you'll recall 2018, 2019, they're not like these largely accelerating years in the economy. There were, we're nearing the end of a business cycle. And so those are kind of like, good moderate rates of growth, sustainable rates of growth are in the 5-6%. So to put a negative sign on that, it shows you it's quite large. So that was a great question because I think that the context is really important. I can throw like a percent number at you and, what does that mean? But this is historical in the magnitude and the timing, that it's just been a total crunch. I don't have the number in front of me for the Great Recession, but you would have seen numbers like this happen over the course of a year, not between quarters. So improving, but I want to make this point, and it's the uncertainty. So as an economist, you will have economists who give you forecasts, and you will hear great confidence in their voices as they give you forecasts about what's to come. Even in the best of times, it's really hard to predict turning points. And given that we have this global pandemic still at play, we were at the end of the business cycle anyway. So we were moving towards some sort of economic contraction anyway. It's really hard to forecast the future. However, the data that we're seeing coming through do give us confidence that there's definitely, we're on a path to improvement. But I will just say that the forecast right now is, for me and for many economists, it's still cloudy. There's still uncertainty. And just to make this point, I go back and I pulled the forecast from the Wall Street Journal. They survey, I think it's like between 60 and 70 economists with different viewpoints, you know, conservative, more on the liberal side, like just different viewpoints. They survey this group of economists on a monthly basis, and they ask, you know, they ask about GDP, they ask about the unemployment rate, they ask about a bunch of different economic indicators. And in this survey, what we're looking at here, the line that we're looking at is what these economists were forecasting the unemployment rate in the United States would be at the end of 2020. And so back in January, you know, things are kind of plugging along. We're getting towards the end of the business cycle, but things are plugging along. And in this survey, economists were predicting that the unemployment rate at the end of the year would be 3.6% for the US. And you can see that little kind of the blue around it. That's the range of forecasts. So there are a couple of economists who thought that the rate could be as high as 5% at the end of the year. Some economists thought it could be a smidge lower than that, 3.6%. But generally, you can see that range is pretty tight. But my goodness, go to May. All right, we see in May, you know, we were all talking at this point, and I was giving you the best information I could given our expectations. So maybe I was talking to a number like this, but at that point, economists in this survey, the average prediction for the end of the year was 11.4%. The unemployment rate in the US would be 11.4% at the end of the year. And I think that even more interesting here is you can see the range. So some economists thought that it would be about 1% at the end of the year, but there were a number of economists that thought that that unemployment rate could grow to above 20% by the end of the year. And you can just see as we get more information, as we're getting closer to the end of the year, you can see that that number is starting to settle and that range is starting to settle. But I think that this graph, it speaks to the uncertainty. And so as you're kind of thinking through your budgeting process, your expectations, you need to just study your data, study your economy, knowing what you know about the different segments of the economy and how they're being impacted in different ways. You need to study the data that you have and make the best prediction that you can, but you also need to acknowledge the uncertainty and potentially think about tools for dealing with that uncertainty. So I'll go into the state data and the local data, and then if we have a couple minutes for questions. But I'm a public finance person, formerly working in the state budget office, and so I'm always paying attention to state and local government budget. So I know that this is what you're all paying attention to. So I just need to show you this data point, which I think is interesting, coming from the National Conference of State Legislatures and taking all this information into account and making it real in terms of planning state budgets. As of early September, there were 38 states who had revised their FY 2021 revenue forecast down. So 38 states. It doesn't mean the other states haven't made a revision yet or don't plan to, but this is just what's been done as of early September. And you can just see like the average projection for FY 21 was reduced by 11%. So you see, of course, and I know that we all work in this world, and so perhaps showing you this data, you're not surprised by it. But as I speak to other groups who aren't really thinking about like, I know the unemployment rate is this, how does that actually get applied into something? And this is real. This is impacting state and local budgets. We are feeling the crunch. And I think that even though we're seeing kind of a settling, are we in kind of this bounce recovery or not is still a question. But, even under a somewhat optimistic outlook, the expectation for state and local governments is quite challenging. So let's look at Utah. Utah, I'm watching my time. Utah better than the rest. Still swift and severe contraction. Here you're looking at the unemployment graph again. That's similar to the one before. I don't have the U6 number in here, so this is just headline unemployment rate. The U.S. unemployment rate gets to almost 15%, is sitting at about 8% now. The Utah unemployment rate, you can see spikes up to over 10% and is now sitting at about 5%. You actually see that little kind of hook on the bottom where the rate hits out and then bumps up to 5%. That has to do with labor force participation. And so if you're not actively looking for a job or in the labor force, you're not counted in the unemployment rate number. And so as things have been settling, as we've been seeing a return to job growth, people are coming back into the labor force and looking for a job, and so they're being counted among the unemployed again. And so seeing that unemployment rate tick up still signals stress. I mean, it's an elevated level for Utah, still signals stress to me, but it's actually a good thing. I'm glad to see that the opportunities available are drawing people back into the labor force. And so again, Utah better than the rest, 5% versus 8% unemployment. It's tough, it's challenging, but better than the rest. I think that some reasons for Utah posting better over this time have to do with the fact that our economy is diverse. You know, you've heard me talk about a measurement we do where Utah's economy is the most diverse in the United States. We came into the pandemic in a very strong economic position. We had this economic expansion was the best in the nation leading up to the pandemic taking hold. So Utah was just better positioned to begin with. And then I think that like our leadership and our just leadership, fiscal policy, those have all set us up to be in a better position. You know, we had an economic, and you know, I mean, we've seen how things played out and we've had to make changes along the way, but we had an economic recovery plan published on March 24th, you know, so well ahead of any other state. We had a number of fiscal policy tools in place moving into this, you know, budget stress testing, building up a rainy day fund. So again, so economic diversity, just strong economic position to begin with, and then just leadership in Utah. Those have left us in a better position. Another way to look at this is if we look at the September 2020 jobs as a percent of February 2020 jobs, Utah, we've got about just under 98% relative in terms of jobs relative to February. So basically a 2% crunch. Now, average annual job growth is in the range of 2.5% to 3%. So when we're talking about being 2% less, that's severe. But Hawaii's employment base has shrunk by 20%. And so again, it's hard to deliver some of these points, but also I'm glad that we're here. You know, so just in terms of kind of Utah's no different than the nation in terms of what sectors have been impacted. Energy, so looking at jobs, September 2019 versus September 2020, what's happened to job bases in various industries. And the same thing, if you were to look at this for retail sales, you'd see a similar picture, but energy, travel and leisure, hardest hit. So we have over 16% less jobs in the leisure and hospitality industry in Utah today than we did 1 year ago. In the energy industry, 12% less jobs today than 1 year ago. Construction's been an absolute bright spot. Now there are all sorts of issues for why we'd have all sorts of reasons for why we'd have such a strong construction sector right now. Some of that is actually trying to keep up with demand. And you know, we know that we've experienced housing affordability issues. Our demand still exceeds supply. And so this is the construction industry just trying to keep up with the demand. It is a bright spot. The fact that industry still continues to go certainly has been helpful for the economy. Other services is kind of interesting. Now that's like, I think that there's some pent up demand there. So remember, and I unfortunately haven't taken advantage of this yet, but you know, our barber shops, our hairstyling shops, all these, you know, kind of personal services were completely closed down early on. There's been pent up demand, and so we're seeing a little bit of a bounce there. So national, state, let's just take a really quick look at local. Unemployment rate's a great way to do that. I mentioned that our economic diversity is, you know, a major reason for why Utah is posting in the position that it's posting. But if you dig deeper, so that's kind of at the aggregate state level. If you dig deeper and you look at the local impacts, there's great variation there, and it is dependent on what, you know, like the level of diversity in those more localized economies, the economic position moving into the pandemic in those more localized economies. You know, we are seeing more challenging situations in those rural areas that have their economies more tied to energy, travel, and tourism, that were, you know, still in a place of economic stress, you know, even even leading into the pandemic. So we're seeing those, we're seeing that result continue here in these data. And I'd be happy to help you kind of dig deeper into your really local economies, but just for kind of a summary overviewing, this unemployment rate very much ties to what I would expect understanding the impacts. And so I don't have a ton of time, so I just I'll close, and again, you can study these, but just talk a little bit about the outlook. The Revenue Assumptions Working Group, which is the Governor's Office, Legislative Fiscal Analyst's Office, the Tax Commission, and a couple some economic leaders getting together to forecast the economy for the purposes of revenue forecasting. They met last week, and the most current, on the far right in those columns, are the most current projections. We think that by the end of 2020, the jobs base will have contracted by 1.4%. So compare that to the expectation of in February. We thought the jobs were going to grow 2.6% when the state budget and when local budgets were put together in February. We're now at a position where it's probably going to be down. Jobs are probably going to be down 1.4%. I threw in the April forecast just because it shows you just how uncertain we were and what, we just really were expecting the worst, and things are much better than we were expecting in April, but they're still really hard. Taxable sales, we think we're going to end the year, at least currently, at just under 6% growth, which is actually, it's close to what happened last year, and much better than the 12% decline that we were initially projecting. And then the one piece, again, bright spot in construction, demand exceeding supply. We are projecting that home prices will be up 10% year over by the end of the year. We have a lot of just natural increased demand for housing. There are people in certain industries that still have good jobs and still have good wages, and they're demanding housing. We're also seeing quite a bit of migration into the state. Anecdotally, we don't have the numbers yet, but anecdotally, we're seeing a lot of folks moving from some of these very, very large urban areas, urban coastal areas, to places like Utah, and so that only continues to drive up housing prices. So I think that I'll just end it there. You can see some notes on trends to watch, and I think that they're pretty intuitive, and we talked about them before, but they're still on my mind. There's not really anything that's popped up that's new since we last talked, but I'll just end there, and I'm not sure if we have time for questions, but as always, I appreciate taking questions offline and email as well.
Juliette, as always, there is a ton to digest here, so thank you for the time and expertise. My last follow-up question for you is something you hinted at, but that deals with consumer confidence. Are you sensing that Utah consumers are more confident now than they were a few months ago? After we finish with you, we're going to talk about the public health impacts of the last few weeks, which have been dramatic. But from the economic perspective, what are you sensing out there?
Sure, I think that's a great question. So from an economic perspective, from the data, we're always kind of looking in our rearview mirror. And so from what I'm seeing in the data, and we've got data through August or so, we see participation in the economy coming back. That is more than what's happening with people regaining jobs or getting income. So to me, that tells me that consumer confidence is coming back, and we saw some of that in those numbers where that pent-up demand is there and people are actually acting on it. So I would say that consumer confidence it seems to be coming back. Again, I don't have a good read on it. We're actually working on a survey of this, and we'll have better data, which is actually really exciting to have actual data on it. But from the data I'm seeing and intuitively, I think it's coming back. However, it's definitely in terms of what I'm thinking about in terms of risk, with the numbers spiking where they are, and I do think that leadership, I respect how they're working to try to mitigate this, but I do think that there's a big risk in we've kind of hit a point where the consumer is coming back, feeling a little bit more confident, but we could start seeing that. I mean, it's touchy, right? And I think that we could, moving into the winter time, see that pull back a little bit. And so maybe by the next time we meet, I can come back with some concrete data on that. But intuitively, definitely improved, but a lot of risk.
Perfect. Well, Juliette, as always, thank you very much. And we will share this presentation with our members and have you back for our next town hall to give an update on all of those other pieces, including a deeper dive into the trends to watch, which certainly as we get into the wintertime and the holidays and the commercial real estate piece will be really fascinating to see that impact. So thank you very much for your time today. I now want to pivot to Greg Bell, the CEO and president of the Utah Hospital Association. And Nick, can you bring up Greg? Greg, Juliette just finished and talked about the risks that we're facing on the economic side, and certainly, unfortunately, that also applies to the risk we've been facing on the public health side over the last few weeks as the majority of the state is in that high transmission index. So give us an update of what's happening in hospitals around the state and what's happening on the ground with the COVID case counts and what that means for us as local leaders.
Thank you, Cameron. Delighted to be with you. My heart is always with cities. I enjoy my own time in city government. The first slide is Utah coronavirus, utah.gov. And here you see the trend beginning at the beginning of the pandemic. So April 1st, we had small incidents, and then of course we climbed. We were very smooth and solid till about Memorial Day. That's when people were frustrated. The weather was good. They got outside. They weren't scared as much. And we started to lose it. That's when we really, on the medical side, public health side, started emphasizing masking. And so that took us into July, and we had a surge and a peak in right after the 4th of July. We became very nervous about our hospital capacity, especially in the ICU beds. But fortunately, we got that down. People were outside. They were pretty compliant with masking. A lot of the bigger retailers started requiring masking. People got the social distancing element. We had a wonderful downturn in August and a flat September. And then boom, here comes school starting and college. And you see here, we were, it's 12.41. It's a moving average of cases per 100,000. So we went, from 3 to here at our peak in July to 20, got down to 12, 13. And then in October, we've just marched all the way up at the end of September, October, till today, the 3-day moving average is 55. So multiples, 3, 4 multiples of where we were. So where does that take us? Here's a slide of the percent positive. This is of great concern. This is of great concern. When we first started, we were deploying tests, and we had in April and May, we stabilized around 4 to 5% positive rate. And when 100 people take a test and 4 of them are positive, you have a high degree of confidence that you're catching most of the people, right? You still have asymptomatic people, but these are self-selected people who are feeling ill or exposed or told to go get a test. So if only 3 or 4 or 5 of them are positive, then there's a proxy value there. Maybe you're missing, a third, a fourth, maybe you're missing 50%, but the spread is not that virulent. Well, then it started to increase, and through the summer, we've had about a 10% positive rate. That trended down in August right here, and then notice what's here. And this is the scary part. This is the scary part right here. Is college starts, university, we have some cold, bam, we go to 14%, we trail along there, and now we're up to 19%. In some counties, Utah County was 25%, and now we're heading to 20% positive. When you have 20% positive on your test, you have to believe that you're missing that many again. And bear in mind, we're administering up to 10,000 tests a day. So we're very concerned about this positivity rate, and it's just going like that. Okay, so Dr. Birx, who's the head of the she's on the White House task force, and Dr. Robert Redfield, the director of the Center for Disease Control, were here Saturday. They met with the governor, House and Senate leadership, well, the speaker and the president, and then the public health leadership. And I was able to go to that meeting. And then later they had a meeting with hospital executives. And so these are the slides that Ambassador Birx is a lieutenant colonel. She's the one that brought AIDS relief to Africa. She's a commanding presence, brilliant woman. These are her slides. So this is the 15th of June, and red is bad, white is no cases. And so, 15th of June, things look pretty cool. 15th of July, not so good, especially in the southern states. They had this terrible spike. You remember what happened in Arizona after the South had kind of been laughing at New York, New Jersey. All of a sudden we have that. Then we caught up with things. So, in the South, they did ameliorative measures. And now in August, they're looking better. In September, much better, right? It starts filtering up into Chicago and up in the upper Midwest. This is last week. So with the cold snap, Ambassador Birx and Dr. Redfield said there's a factor of 45 degrees. They figure that once outside temperatures are 45 degrees, people go indoors, they take their socializing indoors, and this is what we have. Okay, let me look for the other. All right, here is, okay, so every hospital has general surgery beds, medical beds, and most hospitals have intensive care units. As you've seen the stories from Milan and other places, first it was ventilators, and then therapies have caught up, and we're not using ventilators as frequently. But we have intensive care units, and everyone's been in one. But the ones we need for COVID are not just ICUs, they're negative pressure rooms. In other words, infection needs to be contained in the room. So when you open that door, the contagion doesn't leak out by the air conditioning pressure. Rather, it's negative pressure. Well, very expensive to build those, to maintain those. Moreover, the crews necessary, the teams necessary to staff these units is just unbelievable in terms of expertise. The technology folks, the nurses, the skilled physicians, intensivists. So here's our ICU population. Now, bear in mind, hospitals don't build unneeded rooms. So we operate our ICUs in 2015 and 2019 towards a maximum capacity. We don't like to have empty space like any other business. So if we go back to the first of this pandemic, you're starting with a base of the University of Utah having 70 to 80% of capacity in its ICU full. Well, here we are. This is April 20th, right? This dark purple, magenta, Juliette would say, is our ICU COVID confirmed. So we had 41, then we trended up here in July to 105 was our high point. We trended down, and then now we're plus 145. Intermountain is essentially full at IMED. The U is essentially full. Steward is getting full, and Mountain Star we're transferring cases to them. So we now have about, let's see, I would say we have 452 ICU beds, and we have far less than 100 of those ICU beds are open for any reason: heart attack, trauma, stroke, end-stage kidney failure, whatever, surgery, serious surgery, cardiac recovery. So Ambassador Birx told us, she said, with your positivity of testing and 2,500 cases Friday, you know, you likely have twice that many cases out there, and you're going to, and she wouldn't predict the number, but she said, you know, you're on a slant like this. And so someone said 10,000, and she said, well, probably so. You're probably on your way to 10,000 cases. So let me stop there, Cameron, and let you ask me what you want to say.
Well, thank you for the sobering data and the information. So one key takeaway I heard you say is with the reduced capacity of ICU beds, that's reduced capacity for anybody, not just COVID, but other ailments and reasons why people would use the ICU. So when you've been on this town hall before, we've had you come urge mask wearing. Most of the state is in high transmission right now under the new index, and mask wearing is a requirement. What other recommendations do you have for city leaders to help get the sense of urgency across to the public?
The good news from Dr. Birx and Dr. Redfield was two things. Number one, that the success they're seeing at universities is opening universities, not doing online, having some activity that is controlled, that is hygienically sound, giving students the sense of belonging and a college experience, but not driving them underground, allowing them to socialize in some ways, because what we did last spring is drove everyone underground. So you're sending 35 kids into a dorm room. You're sending 25 30-somethings from the bar into somebody's tiny apartment. And so they're seeding this disease. The wicked thing about this disease is that the young people get it, are asymptomatic typically, and spread it. And I said to Dr. Birx, my understanding was young children don't spread it. She said, young children are the best spreaders possible. The next best is the 18 to 34-year-old asymptomatic. They have the disease, they have a high viral load, a 5-year-old can bring it home, never have a fever or any sign, hug his grandma, and grandma goes to the ICU and may or may not make it. So we need to do a lot of rapid testing, and those are 15-minute non-medical administered tests. So they promised to get us those so we can open things up. The second part of it is they said they expected vaccine to start being deployed in December, in late November, December. That sounded a little political to me, but she's a real professional. She said, no, that's true. The place we've got to concentrate is on social spread. It's not being spread in malls and salons and restaurants. Can you get it there? Yes, if someone's careless. But we pretty well know how to do all that stuff, right? We know about grocery stores, pharmacy. People are not getting it there typically, nor are they typically at the workplace. It's social spread. And so what they're emphasizing is not families, not limiting it to families, but our social gatherings have to be limited to households. Cousins, aunts, uncles, brothers-in-law who don't live with you, grandmas who don't live with you are off bounds. And so the message to the governor and the leaders was we need to social distance, we need to wear masks, and we need to stop social gathering for the next several weeks, including Thanksgiving and through the holidays, with other than our individual family. Now that's a tough pill for Utah to swallow, but that's what they're saying.
You're right about that being a tough pill to swallow, particularly as the weather turns cold and the holidays arrive. One of the questions in the chat box asked about the length of stay in ICU versus non-ICU beds. Are we seeing people staying in the hospital longer than they were in the spring, or people coming in and out at a faster rate?
We are seeing some improvement. We're seeing fewer people go to the ICU because we can handle them earlier with remdesivir, with the steroid drugs, and we just have better therapies, right? So we can avoid some ICU. Patients who are not seriously ill, we can shorten their stay in the hospital altogether. A follow-on question here is personnel from other states. We're doing everything possible in that regard, but bear in mind, we have 45 states who are seeing a surge. So there aren't teams sitting around. Our teams are exhausted. They've been doing this for going on 7 months. They've been doing this since March, and they have families who are infected. They have families who are struggling with school. We're down 20% plus of our skilled nursing staff in the ICUs. So other parts of the hospital may not be all that busy, but our ICU COVID units are just over the top. And then here's a question about setting up alternate locations. It helps to have skilled nursing facilities with medically trained people, with nurses, et cetera, because we can discharge lower acuity patients. It doesn't help so much to have alternative beds at Mountain America Expo Center because we're already too short on crews. And so we don't have the personnel to send to an alternate facility.
Thank you, Greg. Let me ask a follow-up question about vaccine prep, because that is the light at the end of the tunnel, even if the tunnel is still a long tunnel. In recent weeks, we've heard from the Department of Health the time frame that you laid out, end of November to mid-December, potentially having the first vaccine that's in stage 3 testing now. There would be an ultra deep freeze, and then you'd only be able to store that at 5 hospitals around the state. And then there's that phase 1, phase 2, phase 3 approach to vaccine distribution. Can you talk a little bit about what you think is realistic for vaccine prep in the weeks and months to come in that phased plan?
Well, the good news is that Dr. Birx and Dr. Redfield were very emphatic that, we have 4 or 5 in trial. They've bought $100 million doses, of everything. Some work, some won't, some will be collector items. They do feel very confident they'll start distribution no later than December 1st. It'll go to the tiered program you laid out. The full delivery will not be till the end of the second quarter as I push them in that. They're confident in McKesson. McKesson does this all the time. The refrigeration and other elements, are barriers and difficulties, but they just felt very confident given the sophistication of our supply chain and that we're delivering similar products, perhaps not at the scale, that they can push that out.
The phase plan that the state of Utah has been working on would have phase 1 go to frontline healthcare workers first, because the number of doses that would likely arrive in December will be limited in number and will have to be stored at the hospitals with the deep freeze capabilities. There has been a lot of dialogue, and this is as much, Greg, for you as it is for everyone listening. There's been a lot of dialogue, again, about the concept of critical infrastructure and essential workers. This is similar to the conversation we've had for the last 7 months on a variety of topics, ranging from contract tracing now to the vaccine distribution. So at this point, everybody who is not in the bucket of frontline healthcare workers or healthcare workers at long-term care facilities, everyone else is in that second and third bucket. So one conversation that's come up is whether any critical infrastructure should move up to the first bucket. At this point, there's likely insufficient supply of vaccine for that conversation anyway. but that is something from a first responder perspective that we'll be watching very carefully as that vaccine becomes available. Greg, any other final comments from the hospital perspective on either where we are now or where we need to go in the weeks to come?
Yeah, we've lost control of this. We just don't have a handle on this, and I wish I could tell you what the next 4 weeks were like and be more encouraging, but given the spread rate and the positivity rate, we're very sober. And, you know, things change day to day. Yesterday, Intermountain felt pretty good about their beds, and today they got slammed. You know, we're admitting 50, 60, 70 people a day to hospitals with COVID. And as I mentioned, the 2 systems are full pretty well, and 1 is almost full. So we've got some units in other less acute hospitals we can push out to, but we got to stay home and take this seriously. And masking and social distancing, intelligent choice of our social settings, those are the key. And I regret so much this libertarian attitude that is rejecting sound public safety, public health measures, because we can save each other from death and disease if we follow those simple things.
Well, Greg, thank you very much for joining us today and for driving home the urgency of the moment, particularly in light of the upcoming holidays and the changing weather in the days to come. So can we get some of the data that you shared? I know some of it's available on the coronavirus.utah.gov website, but any other information that you have that you're willing to share, send it our way. We'll send it out to the membership, and hopefully the appeal that you made, you'll hear from local government leaders around the state urging residents to do their part.
Yeah, thank you. It all starts and ends with the cities. You guys are great.
Perfect. Well, thank you, Greg. And once a mayor, always a mayor. So thank you for coming back to your roots to join us today. Our last speaker today is Policy Director Wayne Bradshaw to talk about the CARES Act, because this week is a crucial deadline for communities outside of Salt Lake and Davis counties. So Wayne, take it away.
Thanks, Cam. As Cam stated, this is the last week for cities and towns outside of Salt Lake and Utah County to access CARES funding. So you have until November 6th, the close of business of November 6th, to let GOMB know that you want your funding, your allotment of CARES funding. At the bottom of the slide, you can see there are 17 communities that haven't accessed any funding. There are 18 communities that have accessed the first set of funding, but not the second or third. And then we have 48 communities that have accessed the first and second tranche, but not accessed the third tranche. If you are one of the 17 communities that haven't accessed anything, you need to go to GOMB's website and complete the Coronavirus Relief Fund application. So you need to send that in, and also contact Taylor Kaufman with your DUNS number if you're receiving over $50,000. For anyone who has not accessed the second tranche or the third tranche, you need to email Taylor Kaufman, and his email is on the slide, and let him know that you're committed to the reporting compliance requirements in your application. What GOMB has communicated to us is they haven't seen a lot of reporting yet to the transparent website. And there's good reason for that. You may have not spent those dollars and there's nothing to report, but they just want to, in email communication as you apply for your second or third tranche, to communicate that you're going to abide by those reporting requirements and that you're working on compliance. And again, if you've only accessed the first tranche, you will need to include your DUNS number in that email communication as well. We do get a lot of questions about how should we be spending these funds in our community. And we get a lot of questions that there are responses to in the documents that the Treasury Department has supplied to guide you on how to spend these funds. We've included these, what I think are the 3 main documents, in a majority of our Friday Facts, and we will include them in the kind of the wrap-up email after this town hall. But the guidance was updated on September 2nd. The OIG record keeping document came out on September 21st, and the frequently asked questions were updated on October 19th. So if you and your staff have not looked at these documents recently, you need to do that because there is clarity, there's updated guidance on how you can utilize these dollars in your community. And as Juliette presented earlier, there's economic impacts on our residents and businesses. There's obviously direct impacts to your residents, and you can utilize these dollars to help them through this trying time. We also have received a lot of questions about using these funds for public safety payroll. And that's why I think reviewing these documents are important, because there's been a lot of clarity on whether you can use these dollars for public safety and how to use them. For example, in the updated guidance from September 2nd, it lists out the employees that you can assume are substantially dedicated. In the September 21st document, it basically says, and I've highlighted that there under public safety, there's no test to say how they're substantially dedicated. You can assume they are, so there's no supporting documents that you have to be provided to prove they're substantially dedicated. You simply need to maintain your payroll documents, and that's what will be provided in any further audits. I also pulled a comment from Dan Klawowski, who is the counselor for the secretary for the U.S. Department of Treasury. He recommended that you spend big in 3 areas. You spend big in your public safety and public health, you spend big in business grants, and you spend big on residential grants. That way you can keep it simple in the record keeping, you can keep it simple if there is a future audit. So I've highlighted some things that you can do for business grants. You can cover if they've received decreased customer demand. You can cover if they've had business interruptions. But a lot of communities are doing, you have to have an application, and then they're doing $1,000 to $10,000 grants for these businesses. You can also provide grants to your residents as well. I will say avoid paying property taxes, but you can cover mortgage, utility fees, and other kind of essential services. And finally, just for Salt Lake County or cities and towns, as you're aware, Mayor Wilson's office has been holding meetings to discuss the 3rd tranche or additional funding. The latest update was from Lisa Hartman today in her office that they are going to hold those meetings again in 2 weeks. So if you've not been part of those meetings in Salt Lake County and would like to, you need to contact Lisa Hartman. And then finally, if there are any questions for us at the League, you can reach out to me at wbradshaw@ulct.org. But again, the final, as my wrap up, the final information is you need to access your CARES funding from the state by the end of this week. If you do not do that, you won't have any ability to access further funding. So make sure that happens. And with that is all I have. And it looks like Cam is just trying to connect his audio. But like yep, still working on it. But there you are.
Nope. Sorry. Yeah, my phone kicked me off. So I could see your mouth moving, and I'm sure it was riveting, but I was unable to hear you. But we're approaching 4 o'clock, so I'll let you take any questions that are in the chat room.
It doesn't look like there are any direct COVID related or CARES fund related questions. So
perfect. Yep, go ahead, Wayne. Let's wrap it up.
I was going to say, feel free again to email me at wbradshaw@ulct.org. If you have questions about the CARES guidance or need some direction. But if you need to access your CARES funding, make sure your city or town is reaching out to Taylor Kaufman at GOMB.
Perfect. And 5 o'clock on Friday, we'll be here before you know it. Terrific. Well, everyone, thank you very much. Juliette and Greg, thank you both for joining us. We'll send a follow-up email soon with all of the information that we presented today. And everybody brace yourself for Election Day tomorrow, and we hopefully will see each other soon post-vaccine. But in the meantime, thank you very much for your engagement in the league.